So, as I said, my job is to, tell you the scientific evidence. I mean, you have been hearing about the association of NAFLD with various non-communicable diseases. So in next, 20 minutes or so, 25 minutes, I'll show you the evidence for that. What is the kind of association which is existing between fatty liver and various non-communicable diseases? Uh, I think what we need to understand is, no doubt fatty liver disease is a liver disease, but then we also need to understand that this fatty liver disease is part and parcel of multi-system disease. People call it as, hepatic component of metabolic syndrome. So, metabolic syndrome can involve, heart, can involve kidneys, can involve your vessels, can cause atherosclerosis, can cause stroke and whatnot, and malignancies. So, same as metabolic syndrome can lead on to NAFLD. So, as I said, it is considered as a hepatic component of, metabolic syndrome. So, as I said, it's a multi-system disease. So, it is associated with lots of, extra-hepatic diseases and important ones are, obviously the non-communicable diseases like cardiovascular disease, diabetes, hypertension, obesity, dyslipidemia. But in addition, it is also associated with, diseases like polycystic ovarian disease, psoriasis, and, not only the liver malignancies, but also various, extra-hepatic malignancies. So as I said, I'll show you some data of its association with predominantly these, diseases like obesity, diabetes, hypertension, dyslipidemia, cardiovascular disease, chronic kidney disease, and the malignancies. And what I'm going to also show you that the link between the fatty liver disease and metabolic syndrome is what we call is a bidirectional link. What do you mean by bidirectional link? Bidirectional means that if somebody has metabolic syndrome or any metabolic risk factor, it could be just diabetes, it could just be obesity, that increases the risk of, having fatty liver disease. So that is one way of looking at it. But the other way is that even if you start with fatty liver and there are no metabolic risk factors, no diabetes, no hypertension, no dyslipidemia, no obesity, over a period of time, long-term data suggests that these patients can develop these metabolic risk factors. So, this is what we call it as bidirectional link. One is, contributing or attributing to each other. That is, I'll show you some data on that. The other important thing what we need to understand is that fatty liver disease you just heard is a spectrum. It can vary from just fat in the liver, what we call NAFL, to NASH, which could be again with or without fibrosis, to liver cirrhosis and liver cancer. Now, who are the patients who are likely to progress? Who are the patients who are likely to have severe disease? Is dependent on lots of factors, but the most important factor amongst them is also the presence of metabolic syndrome or the metabolic risk factors. More the components of metabolic syndrome you have, more is your risk of having NASH with fibrosis, cirrhosis, and liver cancer, and I'll show you some data on that. Lastly, I'll show you some data about its association with, as I said, various cardiovascular diseases, chronic kidney diseases, hepatic and extrahepatic malignancies. And mind it, when we say this relationship, this is all independent of metabolic syndrome. Fatty liver disease per se, even if you don't have metabolic risk factors, is putting you at a risk of having cardiovascular disease, chronic kidney disease, hepatic malignancy, and extrahepatic malignancies. And again, I'll show you some data on that. So let me start with, what is the association with NAFLD and metabolic syndrome? What is the evidence in science? So there are lots of studies, which have very clearly shown that these two, diseases are very closely linked, which I said that NAFLD is considered as a hepatic component of metabolic syndrome. I just picked up this large study, so-called the Rotterdam study, around 3,000 participants, and around 1/3 of them had, NAFLD. So when they looked at the risk factors, that who are the patients that who are having fatty liver disease, they were nothing, but they were all metabolic risk factors. Look at this. If you have waist circumference, which is high, or what we call, if you have central obesity, your risk of having NAFLD goes 5 times. If you have diabetes, your risk of having fatty liver goes 2 times. Similarly, if you have hypertension or abnormal triglycerides, your risk of fatty liver goes up by 1.5 to 2 times. So I think there are a lot many studies like this which have very clearly shown that if you have these risk factors, your risk of having fatty liver goes up. This is our own work at Chandigarh. I think Professor Singh was pointing out that the fatty liver disease in Punjab and Chandigarh has to be much more than rest of the India, and that's absolutely true. And this is our work we did, I think, a few years back. And what we did was we just screened the blood donors who were coming to PGI Chandigarh for blood donation. And we did very simple thing in them, took their blood, did their lipid profile, did their liver function test, and also simultaneously we did their ultrasounds. And to our surprise, 53.5% of these blood donors had fatty liver disease. I mean, which is alarming. And this is way ahead of the figures which are globally accepted as 25 to 30%. We have recently completed a PhD work where we have done the prevalence of fatty liver disease in the urban part of Chandigarh and the rural part of Chandigarh. We took a village near in Haryana. And again, to our surprise, the figures in urban part were again close to around 53%. But in the rural part also, the figures was as high as 30%. Which is also very, very alarming. I mean, so Punjab, Chandigarh, I think we are different. And why? Again, if you look at this study, when we looked at that, what are the risk factors? Why these patients are developing fatty liver disease? They were nothing, but they were all metabolic risk factors. Look at their BMI, waist circumference, which is central obesity, blood pressure, cholesterol, metabolic syndrome. I think the kind of overweight, obesity, dyslipidemia, diabetes, hypertension we see in this part of the country is obviously different from rest of the part, and that's the reason I think the fatty liver disease prevalence is also higher in this part of the country. But the point I was trying to make here was that these are the metabolic risk factors which are determinant of your fatty liver disease. Now coming to the second aspect, that what is the prevalence of NAFLD in patients with fatty liver disease. For example, if you take patients with metabolic syndrome, what is the prevalence? As I said, the general prevalence, we told you, if you look at globally, the figures are close to say 25 to 30%. But then if you look at these special groups, those who are diabetics, those who are hypertensive, those who are metabolic syndrome, is the prevalence higher in them? The answer is yes. And what is the data? The data is, again, I'm showing you only one, this very large study. This is a meta-analysis of around 80 studies around 20 countries done by, Zubair Yunusi, who's done a lot of work on fatty liver disease. And the global prevalence of fatty liver disease in patients with type 2 diabetes was 55%. Which means in the general population, same group, Dr. Zubair Yunusi has done a work or done a meta-analysis general population, and he gave that figure of 25%. But in the diabetics, the figures were more than double. It is 55.5%. Right? So if you have diabetes, and obviously, as I said, more the components of metabolic syndrome, your risk of having fatty liver disease definitely goes up. This is our own Indian data down south from Dr. V. Mohan's group. Again, they looked at, the subjects and they divided them into those with or without diabetes. And in the diabetes, the prevalence of fatty liver disease was again 55%. In contrast to those who did not have diabetes, it was only 22%. So again, I think the metabolic risk factors are putting you at a higher, prevalence of having fatty liver disease. I thought I'm giving this talk, I'm in Punjab, Batinda. So I was just looking at the Punjab literature also. And this is one study I found, recent study last year from Medical College, Faridkot. And what they have done is they just taken, 200 subjects, 100 again with metabolic syndrome as per what we call the ATP3 criteria. ATP, I think if there are any postgraduates, is the adult treatment panel 3 criteria. And they took 100 controls and they looked at the just prevalence of ultrasound, fatty liver by ultrasound. And again, look at the prevalence. 73% in those who had metabolic syndrome in comparison to 38% those who did not have metabolic syndrome. So I think again thereby making a point that the figures of fatty liver disease, if you are diabetic, if you are obese, if you are metabolic syndrome, is much higher in comparison to those who do not have these risk factors. Now let's look at other angle. Suppose you take patients with fatty liver disease. These were the patients we were taking, metabolic syndrome or diabetics, as I said. But now, and then we discuss about the general population. But then let's look at that the patients, those who visit to our clinic, in hepatology clinic, liver clinic, or for that matter, say in the general medicine clinic, the patients would come as, incidental detection of fatty liver disease, or they will come as incidental detection of raised transaminases. And when they are worked up for dyspepsia, for raised transaminases, they are found to have fatty liver. People go for blood, donation. People go for organ donation, and during that screening, many of them are found to have, fatty liver. So what is the prevalence of metabolic risk factors in them? Again, the time doesn't permit me to, show you all the data, but this is one our large data from our country. We have a consortium in India called Indian Consortium on Non-Alcoholic Fatty Liver Disease. And in short, we call it as ICON-D. And 40 centers in the country, all over the country, all parts, southeast, east, west are participating. And we have 40 participating centers right now. And a few months back, we did this interim analysis. By that time, we had collected around 4,000 patients in this consortium. And the purpose of showing you here is that if you look at this, the presence of overweight and obesity together was seen in around 89% of these patients. Only 10-11% of patients were so-called what we call lean NASH or lean NAFLD. There's a terminology called lean NAFLD. Lean NAFLD means those who have normal BMI. And for us in Asia or for India, the normal BMI is less than 23. So 23 to 25, we take it as overweight, and anything more than 25 is taken as obesity. These are the Indian or the Asian cutoffs, which are different from the, the international cutoffs. So with the Asian cutoffs or Indian cutoffs, as I said, only 10-11% were so-called lean. Rest all 90% had, and predominantly they were obesity. 73% were obese, 16% were overweight, and only 10-11%, as I said, were lean. And when we looked at the metabolic, syndrome and the metabolic risk factors in them, the metabolic syndrome, which is, as I said, which is defined as 3 or more criteria as per the ATP3 criteria, was seen in 43%. But when we looked at that at least one risk factor, that how many had at least one risk factor, 93% of them had at least one risk factor. And what was the commonest risk factor? It was the central obesity, which was seen in 83 to 84% of these patients. So the point I'm trying to make is that any patient with fatty liver disease who's walking onto your clinic, and if you see that he's obese, or if you ask him that he's a diabetic, I think there are all probabilities that that person will definitely have fatty liver disease. And as I said, the risk of having fatty liver disease would keep increasing as the number of components of metabolic syndrome keep going up. Now, as I said, I was talking about in the beginning about the bidirectional link. Bidirectional link means that you start with fatty liver and there are no metabolic risk factors. As I said, no diabetes, no hypertension, nothing. And you start with fatty liver. So are you at a risk of developing these metabolic risk factors on a long-term basis? Again, the answer is yes. And this is again, I have picked up a study with not very high numbers, around 130 patients, biopsy proven NASH, but the follow-up was a mean follow-up of around 13 years. And this is a most quoted study, and where they started, and in the beginning, these patients all had fatty liver disease, as I said, biopsy proven NASH. But then if you look at the figures of diabetes in the beginning, it was only 8.5%. So only 8.5% had diabetes when they started this study. But at the end of the follow-up, say after 13 years, look at the figures of diabetes and impaired glucose tolerance, it is 78%. So which tells you indirectly that even if you start with fatty liver, your risk of long-term developing, diabetes, and I'll show you that on other metabolic risk factors, actually goes up. And thereafter, there have been large number of studies which actually have shown again, I'm not going on to all these individual studies, that the risk of, fatty liver disease, risk of having diabetes, goes up in patients with fatty liver disease on a long-term basis. This is known as incident, diabetes developing in patients with, NAFLD. Same is, there are large number of studies where the risk of incident hypertension goes up. You start with fatty liver, no hypertension, but later on people would develop, hypertension. And this is, again, one meta-analysis which I picked up, which actually looked at, again, a median follow-up of around 5 years or so. And they said, yes, your risk of, the diabetes goes up with fatty liver maybe up to 2 times, but your risk of having metabolic syndrome also goes up by 2 times. That you, in the beginning, you don't have metabolic syndrome, but over a period of time, after 5 years, your risk of having, metabolic syndrome goes up maybe by around 5 times. The other thing which I said in the beginning was that the all fatty liver disease are not same. Patient can have just fat in the liver. You can have NASH with fibrosis, cirrhosis, liver cancer. And as I said, there are various determinants for this severity. But what is the relationship of metabolic syndrome and the metabolic risk factors with the severity of fatty liver disease? So again, the answer is that the metabolic syndrome determines, your risk of having severe liver disease. This is the same meta-analysis which I showed earlier, where the prevalence of, fatty liver in patients with diabetes was around 55%. But when they looked at the prevalence of NASH in these diabetics, NASH is a severe form of fatty liver disease, where in addition to fat, you tend to have inflammation, you tend to have fibrosis. And in the global population, if you look at the prevalence of NAFLD is around 25-30%, but the prevalence of NASH is only around, say, 5-10%. But in diabetics, when they looked at the prevalence of NASH, it was 37%. So again, you're telling you that if you are diabetic, if you have metabolic risk factors, your risk of having severe liver disease goes up. Similarly, the advanced fibrosis was seen in around 17%, which is also, a huge number. Again, there are lots many studies again, but again, to summarize these studies, what I have done here is to show you that the risk of progression of this disease, which means your worsening of fibrosis, is dependent on these metabolic risk factors like diabetes, your obesity, your LDL, your central obesity, insulin resistance, and, again, diabetes and hypertension. So again, lots of studies have shown that if you have these risk factors, your risk of, having a progressive NASH or your progression of fibrosis really goes up. And this is again a very nice study from Baylor School of Medicine, US, and where they have shown that if you have metabolic risk factors, your risk of having cirrhosis and liver cancer goes up. And if you look at here, that if you are somebody has diabetes, obesity, hypertension, and dyslipidemia, then the risk of HCC is around 6 times, and the risk of cirrhosis is around 3 times. So again, I think thereby stressing upon the same point that metabolic risk factors definitely increase the severity of, fatty liver disease. Now, what is the pathophysiological link between the NAFLD and metabolic syndrome? This was spoken earlier, but then let me just in short tell you that, when we have fat in the liver, so basically there are 3 contributors towards fat in the liver. The important one is the adipose tissue, because the adipose tissue, get rich in fat, and there is an insulin resistance which is happening at adipose tissue level. The normal function of the insulin in the adipose tissue is to keep the fat in the adipose tissue. So when there is an insulin resistance, the insulin is not able to keep fat in the adipose tissue. So there is increased lipolysis which occurs from the adipose tissue. Lipolysis means increased delivery of free fatty acids from the adipose tissue. They come into the liver. So that is the major source of, fat in the liver for patients with NAFLD. Other is there is something called de novo lipogenesis, that the fat is synthesized in the liver. And the third is your dietary intake, which also contributes to the fat in the liver. So now once you have fat in the liver at molecular level, lots of changes happen, and that leads on to insulin resistance in the liver also. That is known as hepatic insulin resistance. And once you have hepatic insulin resistance, the normal action of insulin is again to inhibit the glucose production in the liver, keep the glucose as glycogen in the liver. But once you have insulin resistance, the insulin is not able to do this job again. So what happens? The glucose production increases and the glycogenolysis increases, right? So both contribute to, increase glucose in the blood, which is known as hyperglycemia. And to counter that, the pancreas would start, secreting more of insulin, and that is what we call the hyperinsulinemia will happen. And end result is that both glucose and insulin goes up, and ultimately, the pancreas gets tired up, and you land up into a stage what we call the diabetes, which happens. And because of this hyperglycemia, hyperinsulinemia, what is the diabetes? But it also affects, your vascular endothelium, leading on to, subclinical and the early atherosclerosis. It leads on to a hypercoagulable kind of state, leads on to, increased triglycerides and lowers your HDL. So basically all leading on to, metabolic risk factors and the metabolic syndrome like phenomena, and increasing your risk of, cardiovascular disease and the cerebrovascular disease and chronic kidney disease and whatnot. Now coming to the association between, the NAFLD and the cardiovascular disease and the chronic kidney disease and the malignancies, which I said in the beginning. Again, there's a lot of literature and it's really not possible to cover all that. But let me again emphasize here is that NAFLD no doubt is a liver disease. But then, as I said, this is part and parcel of a multi-system disease. And if you look at the causes of deaths in patients with NAFLD, the most common cause of death is not liver disease. The most common cause of death in patients with NAFLD is cardiovascular disease, followed by malignancy, and the third cause is the liver-related deaths. So obviously that tells you that these patients are at a higher risk of having cardiovascular disease and are also at a higher risk of having various kinds of malignancies. Now, what are the various kinds of heart diseases which can happen? They can be of different types. They can be in the form of various structural abnormalities, like you can have more of calcium deposition in the coronaries, you can have subclinical atherosclerosis, your arteries can get stiffer, and you can have, fat deposition in the myocardium and in the epicardium. And all this can lead on to, cardiac arrhythmias, can lead on to functional abnormalities of, LV systolic and LV diastolic dysfunction, and abnormalities in the myocardial metabolism, prolonged QT interval, lateral fibrillation. So all these, things can happen. So again, to cut it short, I'm showing you this meta-analysis where they have shown that if you have fatty liver disease, your risk of having fatal cardiovascular events and non-fatal cardiovascular events is much higher in comparison to somebody who doesn't have fatty liver disease. So definitely, that the patients with fatty liver disease are at a higher risk of having cardiovascular disease. This is again another meta-analysis similar to the cardiovascular disease, that if you have NAFLD, again, it is again very large number of participants, around 63,000 participants, 33 studies, and we looked at the relationship between NAFLD and chronic kidney disease. And again, they showed that if you have NAFLD, your risk of having chronic kidney disease goes up by maybe 2 times. But if you have NASH, or if you have NASH with advanced fibrosis, your risk of having chronic kidney disease further goes up, maybe 5 times or 3 times here, which actually tells you that more is the severe liver disease, which means NASH with fibrosis, your risk of having extra-hepatic diseases like cardiovascular disease, chronic kidney disease also goes up. Again, this is our own work, I think, where we had done, the screening for microproteinuria and macroproteinuria in patients with NAFLD, and calculated their GFRs to look whether they have chronic kidney disease. And we found that around 30% of these patients actually had impaired renal function, as demonstrated by either proteinuria or by abnormal GFR. And again, if you look at the factors, other than the metabolic risk factors, the advanced fibrosis, as we determined on transient elastography or fibroscan, which means if you have severe disease, who are the independent, predictors for having impaired renal function. Finally, coming to the malignancy part, I think, obviously patients with fatty liver disease are at a higher risk of having liver malignancy, which is hepatocellular carcinoma. Again, there's a lot of literature on this, but the important thing what we need to remember is that the NAFLD or NASH as a cause of liver cancer over the years is going up, and this is becoming one of the common indications of liver transplantation in patients of liver cancer who are being subjected to liver transplantation. And similar to the global experience, we recently analyzed our own data of around 800 patients with liver cancer, and we found that the NASH was actually responsible for around 18% of these liver cancers. But again, when we looked at the trends over a period of 9 years, what we found was that the NASH as an etiology of liver cancer was going up in these in these 9 years. So again, I think, as I said, which is a global trend. Finally, again, I think other than the liver malignancy, how about the relationship between the extrahepatic malignancies? Again, I think there are lot many studies, but I have picked up again one this meta-analysis, 10 cohort studies of around 182,000 individuals, and 25% of them having fatty liver disease, and they were all followed up, and the median follow-up of around 6 years, and there were around 8,500 incident cases of extrahepatic malignancies which were occurring at different sites. Now, when they divided and looked at what is the difference of these extrahepatic malignancies in patients, those who had NAFLD versus those who did not have NAFLD, patients with NAFLD were 1.5 to 2 times at an increased risk of having GI cancers of esophagus, stomach, pancreas, and colorectal malignancy. And these patients were also at 1.2 to 1.5 increased risk of having lung, breast, gynecological, and urinary tract cancers. Right. So again, telling you the fact that fatty liver disease is not putting you at a risk of only liver malignancy, but also lots of extrahepatic malignancy. Finally, I think this would be maybe my final slide. I have told you that the relationship between fatty liver disease and metabolic risk factors, bidirectional link, and also that it determines the severity. But now, ultimately, what we basically are looking at are the longevity of the patients. Your patients should be doing well. They should be, surviving longer. So is this, all these metabolic risk factors in patients with fatty liver disease, are they responsible for causing, deaths in these patients? Or are they responsible for, improving their survival? Again, I think this is a very nice study done by Professor Zubair Yunusi's group, where they have looked at these modifiable risk factors on long-term outcomes in patients with NAFLD. But to summarize this, what they found was that if you have good health metrics, in cardiovascular disease, you call them as good, you call them as bad, you call them as intermediate, depending upon your physical activity, your blood pressure, your diabetes, your cholesterol, your smoking, your body mass index. So if you have higher, ideal these health metrics, that correlated, very well with your lower risk of having all cause and cardiovascular mortality, which means that you can prevent these patients from dying from cardiovascular disease, or overall you can prevent them from dying if you maintain a good health metrics in them, which means that if you ask them to maintain their body weight, if you ask them to maintain their blood pressure, their cholesterol, their diabetes, I think that this is what this study showed. And this is what is, you will hear the next talk on the integration of this NAFLD into this national program on the cardiovascular disease and the cancer and the stroke and all. So I think this is, the aim is, to kind of, the looking at the quantum of this disease of metabolic syndrome and the fatty liver disease. I think the focus has to be on prevention and the preventive strategies, and I think integration of this NAFLD into this national program, I think, is really going to give a good boost to managing this particular disease. So let me summarize what I said in last few minutes is that NAFLD is associated with a lot of extrahepatic diseases, predominantly what I told you about various non-communicable diseases, what we understand them as metabolic syndrome. But the relationship is bidirectional. Bidirectional means that there is increased risk of NAFLD in patients with metabolic syndrome or with their individual components. And on the other hand, if you start with only fatty liver, your risk of long-term risk of having diabetes and other components of metabolic syndrome also go up. So this is the bidirectional link. And also we understood in last few minutes that the metabolic risk factors also increase the severity of fatty liver disease, which means your risk of having NASH, NASH with fibrosis, liver cancer, cirrhosis, everything goes up if you have these metabolic risk factors. And I also showed you data about the relationship of NAFLD with cardiovascular diseases, cardiovascular events, chronic kidney disease, and malignancies, and these all can happen, independent of various metabolic risk factors. And all this has, bearing on the management of these patients. But the important thing or the important emphasis should be that, with the prevention of all these metabolic risk factors, the fatty liver disease also is kind of preventable, and you can change the natural history of these patients. You can prevent them from getting into cirrhosis. You can prevent these patients from getting into liver cancer. You can prevent cardiovascular and all-cause mortality in these patients if you are able to control metabolic risk factors in these patients. So thank you very much for your kind attention, and I'll stop sharing my screen. Thank you.